The role of a mental health and wellness practitioner is multifaceted and deeply impactful. These professionals serve as facilitators of emotional healing, personal growth, and psychological stability. They are trained to support individuals who are experiencing emotional distress, cognitive disruptions, or behavioral challenges. A key part of their function is to assess clients' mental wellness, understand their unique life situations, and collaborate with them to develop strategies that improve overall functioning and life satisfaction. Unlike general well-wishers or casual listeners, practitioners apply evidence-based methods and structured approaches that help clients move from a state of confusion or discomfort to one of clarity and balance. Mental health and wellness practitioners must begin their work with a comprehensive understanding of human psychology, emotional development, and behavioral science. This foundation allows them to evaluate a person's mental state effectively and determine appropriate interventions. Their knowledge spans areas such as communication styles, attachment theory, stress responses, resilience, trauma-informed care, and emotional intelligence. Beyond academic understanding, they also cultivate empathy, patience, and active listening skills, which are essential in creating a space where clients feel heard, validated, and safe. Practitioners are not simply advice givers. They are trained listeners and guides who empower clients to explore their thoughts, feelings, and behaviors constructively. A practitioner's responsibilities also include conducting assessments to identify specific needs, symptoms, or challenges that clients are facing. These assessments may involve structured interviews, standardized questionnaires, or observational techniques. The goal is to gather relevant information about a person's mental, emotional, and social well-being in order to formulate a personalized wellness plan. This plan may outline goals, coping strategies, therapeutic activities, and progress markers. It is designed not only to address current difficulties, but also to strengthen the client's long-term capacity for self-care, resilience, and emotional regulation. Collaboration is central to the work of a mental health and wellness practitioner. Rather than positioning themselves as authorities over the client's life, effective practitioners engage in a cooperative process that respects the autonomy and lived experience of the individual. They ask questions, offer reflections, and provide tools that help clients uncover their own solutions. This collaborative relationship fosters trust and helps individuals take ownership of their mental wellness journey. Clients are more likely to achieve meaningful change when they feel respected and involved in the therapeutic process. In addition to working with individuals, practitioners may also support couples, families, groups, or communities. Each context requires different approaches and techniques. For example, family sessions might focus on improving communication, resolving conflicts, and rebuilding trust. Group settings may involve shared experiences, mutual encouragement, and collective problem solving. Practitioners must be adaptable in their approach, tailoring their methods to suit the specific group dynamic and the unique goals of each setting. The ability to transition between different formats and scales of engagement is an essential skill in the field of mental health and wellness. Mental health and wellness practitioners must also be skilled in recognizing when clients need additional or specialized support. While they are trained to handle a wide range of emotional and psychological issues, there are cases where referral to another professional, such as a psychiatrist or medical doctor, may be necessary. Practitioners must know how to make these referrals sensitively and ethically, always prioritizing the well-being and best interests of the client. Maintaining clear professional boundaries, protecting confidentiality, and practicing within the scope of their training are fundamental responsibilities that safeguard the trust and safety of their clients. Another critical aspect of the practitioner's role is psychoeducation. This involves teaching clients about mental wellness concepts, emotional processes, and practical skills that they can apply in daily life. For example, a practitioner might educate clients about the nature of anxiety, how stress affects the body, or the importance of setting healthy boundaries. This knowledge empowers individuals to understand themselves better and make informed choices about their actions. It also reduces fear and confusion, replacing them with insight and direction. Psychoeducation is often an ongoing part of the wellness process, integrated into sessions as needed. Practitioners must also stay informed about current research, techniques, and best practices in the field of mental health. The field is constantly evolving, with new insights emerging from psychological studies, behavioral science, and clinical practice. Continuing education and professional development ensure that practitioners remain effective, ethical, and responsive to the changing needs of those they serve. This dedication to growth and learning is not just a professional responsibility, but a moral commitment to those who place their trust in the practitioner's care. In many settings, mental health and wellness practitioners are part of multidisciplinary teams that include social workers, educators, healthcare providers, and other specialists. In such environments, collaboration and communication across disciplines are essential. The practitioner brings a unique perspective focused on emotional and psychological well-being, contributing to holistic care plans that address the full spectrum of a person's needs. Working within these teams requires not only clinical expertise, but also interpersonal skills, cultural sensitivity, and the ability to advocate for clients in diverse settings. Ultimately, the role of a mental health and wellness practitioner is about helping people live healthier, more fulfilling lives. They support individuals in recognizing their strengths, addressing their struggles, and building habits that promote long-term emotional health. Through their knowledge, compassion, and dedication, practitioners create a positive ripple effect that touches not only the lives of their clients, but also the communities in which they work. Their contribution to mental wellness is both profound and enduring, making them essential allies in the pursuit of a more compassionate and balanced society.